The issues affecting you. Revealed, explained, discussed. Now on WGAL 8 in Focus.
Hello, I'm Susan Shapiro. The coronavirus vaccine rollout has been slower than federal officials had expected. Many of you also have asked questions like, how will you know when it's your turn to get vaccinated? Tonight, we'll take your questions to the experts and to state health officials as we continue to bring coronavirus in focus. I'm joined now by Pennsylvania Secretary of Health, Dr. Rachel Levine. Dr. Levine, thanks for joining us.
My pleasure. Thank you.
The new variant of the coronavirus, the UK variant, has now been identified in Pennsylvania. How much of a concern is that to you?
Well, it's not surprising that we have identified one case of this variant. We expect that this variant will be seen really throughout the United States, including in Pennsylvania. We're going to be continuing to watch for it, and particularly watching for any evidence of community spread of the variant. This was actually someone who had traveled from another country.
But it is said to be more contagious. Do you think that could be possibly linked to the current surge in cases?
We have no evidence of that. Yes, there is evidence from the United Kingdom that this variant is more contagious and has certainly led to a significant increase in the number of new cases in the United Kingdom. We have no evidence that there is widespread presence of the variant in Pennsylvania or the United States. But as you said, we are seeing an increase in our numbers. And again, we feel that this is due to traveling during the Christmas and New Year's holidays, as well as gatherings that people had, which spreads the virus.
That brings me to the vaccination program. It has been criticized a bit for rolling out slowly, especially in Pennsylvania. How do you react to that?
Well, so I understand that there is certainly a lot of demand for the vaccine, and that is good, and a lot of people watching the rollout of the vaccine. I think that the federal government overpromised in terms of the number of doses that would be done by the beginning of the new year. It's always a challenge if federal authorities or government authorities overpromise and underdeliver. I think some of the challenges that all the states have had could be anticipated in terms of the holidays, just trying to roll this out over Christmas and New Year's. But we're past the holidays now, and the vaccine is rolling out very well in Pennsylvania through hospitals and federally qualified health centers and vaccine clinics with our county municipal health department partners for healthcare workers. And then the other mission is working with Walgreens and CVS to roll this out to staff and patients at nursing homes and other long-term care facilities. So those missions are proceeding, and our vaccine numbers are increasing nicely.
And in terms of when you get the vaccine from the federal government, does that change week to week? How does that work?
Well, that does. So, we get a week or two ahead of time an estimate of how much vaccine we'll be getting, but that is an estimate, and we find out essentially on Friday afternoon how much vaccine we'll be getting for next week for both missions. The vaccine rolls out over the course of the week, and so this week's allocation could be being delivered last night or this morning, for instance, to a hospital. Of course, it's not going to be administered as soon as you get it. It comes, as someone said, like a real frozen popsicle. I mean, it's completely frozen. The Pfizer is minus 80 degrees centigrade, so it takes some time to thaw and get prepared to administer. So there's always going to be a difference between the distribution numbers and the administration numbers because of that fact.
And we've received in Pennsylvania, what, more than 600,000 doses already? And how many have been given?
So in Pennsylvania, we have given over 230,000 doses of the vaccine with both missions, and that's a first dose. We're starting to actually give second dose of the Pfizer vaccine as well. I don't have those numbers at my fingertips, and so I think that the vaccine program in Pennsylvania and throughout the nation is ramping up, and I think we're going to develop a very good rhythm of vaccinations for both missions, and it's going to proceed.
Is it going to be more of a challenge, though, once you get to the general population?
Yes. We're going to be working through the recommendations from the Advisory Committee on Immunization Practice from the CDC. And they have 1A and 1B and 1C designations. And then the general public. I can't tell you when the general public will be receiving the vaccine. Really, that's going to depend mostly on the production of the two vaccines, the Moderna and Pfizer vaccine, and then also, hopefully, when further vaccines in the pipeline get approved, the Johnson & Johnson vaccine, the AstraZeneca vaccine, and then even some more in the pipeline.
All right, well, a lot of our viewers want to know when they can get their vaccine and how they'll be notified. We'll pose some of their questions to you when we come back.
This is WGAL 8 in Focus, coverage you can count on.
I'm joined once again by Pennsylvania Secretary of Health, Dr. Rachel Levine, and we have some questions from viewers from our News 8 Facebook page about the COVID-19 vaccine. Cheryl asks, if you already had COVID-19, do you have to wait to get the vaccine?
Well, so you do not have to wait to get the vaccine. So according to the rollout of the vaccine, it doesn't make any difference if you've had COVID-19 before. We want to make sure that you get the immunization to have even more protection.
Is there any risk in getting the vaccine if you have had the disease?
There is no known risk to getting the vaccine, even if you've had COVID-19.
All right, well, that's a good thing because certainly plenty of people have had it. Thank you for that. And Beth W. asks, will we be notified when we can get the vaccine? I am in the 65 plus age group. But that's what a lot of people are asking. How will I get a notification?
Well, we're going to be notifying people through our press conferences and through our press releases, of course, through our social media pages, and then television shows like this, as we increase the number of people getting the vaccine and we go through the phases. So we will do a widespread notification and give people the information about how they can access the vaccine.
You know, I've heard a lot of other doctors say, be patient. What are you advising people, who are like a little bit on edge? When can I get this vaccine? I want to feel better and get a little bit of my life back.
Well, it's really difficult at this time with the size and scope of COVID-19 pandemic to ask people to be patient, but we are. This is a brand new technology. This is a brand new vaccine. This is a nationwide program through states and territories and big cities to distribute the vaccine. We are coordinating with the federal government, we're coordinating with local officials, and we're going to do everything possible to get this out as efficiently as possible, and so people can get the vaccinations that they need.
Dr. Levine, were states like Pennsylvania ready for something like this, or has it kind of been a learning curve and you're learning as you go?
Well, both. So we have been preparing for the rollout of the vaccine for months now with the federal government. But of course, things are being developed, over the course of the fall. The clinical trials were continuing in the fall for both the Moderna and the Pfizer vaccine. We learned more about what some of the challenges would be in terms of distribution. For instance, the Pfizer vaccine has to be kept at minus 80 degrees centigrade. That's a challenge in terms of transportation and how it gets distributed. We learned in December the recommendations from the CDC about the priority groups in terms of that. So, have been preparing, but it still is. This is still a challenge. This is an operation, a public health operation of size and scope that has never happened before in the United States. And so, we are all working and learning together, and we stand committed to get the vaccines to people who want them and need them in Pennsylvania.
And one last question from one of our viewers. Trevor asks, has the vaccine been tested on cancer patients?
So the vaccine has been tested on many different types of patients. I believe that there were patients who have had cancer in the vaccine trial groups, but I don't have actually detailed information about those groups. I can tell you that the CDC and the FDA have reviewed all of that information very, very carefully, and they are recommending it, to people who have chronic illnesses such as cancer.
And just quickly, do you believe that this will work on this new variant?
There is every reason to think that the vaccine will work on the UK variant. I know that that the pharmaceutical companies working with public health in England are testing that now, but there's every reason to think that the variant will be covered by the vaccine, and the vaccine will protect against it.
Dr. Levine, thank you for taking the time to join us.
Thank you very much.
And coming up, a member of the FDA's Vaccine Advisory Board will join us when we come back.
This is WGAL 8 in Focus, coverage you can count on.
I am joined now by Dr. Paul Offit, who is a member of the FDA Vaccine Advisory Committee and an infectious disease physician at Children's Hospital of Philadelphia. Thank you so much for joining us.
Thank you.
As a member of that committee, what made you decide to vote in favor of the emergency authorization for these vaccines?
The data were overwhelmingly convincing, both from a standpoint of safety and efficacy. Here were two vaccines that were about 95% effective at preventing disease, including in people who are over 65 years of age, including severe disease, including people with a variety of comorbidities. I think the data were overwhelmingly clear. It was an eeasy decision.
Do you think it was tested in enough of the population, different people in the population?
Yes, I mean, that was very important for these trials when they were launched. So to make sure that you have an adequate representation of the Black or African American community, the Latinx or Hispanic community, and that trial, and those who are greater than 65 years of age, those trials, one 30,000 big, the other 44,000 big, represented America.
What is your view on the rollout of this vaccine now that it's here and people are getting it?
It's been disappointing. I mean, as hard as it was actually to make a vaccine within, frankly, a year of having the virus in hand, two, novel strategies, this messenger RNA strategy, that was hard to do. But it's also hard to mass produce, mass distribute, and mass administer the vaccine. That also requires money. I mean, the $24 billion effort to actually make the vaccine now is going to require a similar effort to do something we don't have in right now, which is a public health infrastructure to mass distribute and mass administer a vaccine. We need to get that infrastructure in place.
What do you think has to change? What do we have to do that?
I think we're going to learn as we go. We're getting better. We're at about 500,000 doses now a day. I think we're going to have to get up to at least 1 million doses a day, which can then within 5 months allow us to have about a 50% immunization rate in the United States, where I think you may start to see some then decline in the incidence of this disease. But I think we're just going to get better at it as we go.
And what do we have to do to get to that herd immunity? Isn't it more like 70%?
Well, first of all, there's 20 million people who have already been said to have been infected, which is to say have been tested and found to be infected. But most people, or many people who had mild or asymptomatic disease, never got tested. So if you look at antibody studies, which is a much better marker of how many people have really been infected, that 20 million is probably off by a factor of 3. It's probably closer to 60 million people, or to say, said another way, almost 20% of the US population has already been infected. So it's very unlikely that when they get re-exposed, they're going to get seriously infected. So we already have that base. So I think if you can vaccinate another 50% or so, then I think you can really start to see a decline in the incidence of this disease.
How long do you think that might take?
I think it's going to take us till at least the summer. That assumes that we're going to get much better at mass vaccination, which is to say stadiums and auditoriums and churches and synagogues, to make sure that we can mass vaccinate. We're not good at that.
Yeah, as you said, we don't have the proper public health infrastructure. And how do you convince people? There still is some, vaccine trepidation in this country in various populations. How do you convince people they should get this vaccine?
I think it's understandable how people could be skeptical. I mean, this was a very quickly developed vaccine, and we're using a strategy, messenger RNA vaccines that we've never used before commercially. But, the proof is in the pudding, and the pudding is these large phase 3 trials, where you've looked at 30,000 people or 44,000 people who've gotten the vaccine. So you have those data. Plus, now you have more than 5 million people who've been immunized with this vaccine. So I think you can say that it doesn't even to date have even what appears to be a very rare serious adverse event problem. So I think as that vaccine continues to roll out, people should get more and more comfortable with it.
Yeah, I mean, there have been some side effects that people have said, and of course, people with severe allergic reactions, have been told that they should contact a doctor before they get the vaccine.
Well, so right. The CDC just put out a report 2 days ago showing that about 11 people per million will have a severe allergic reaction, which obviously is a frightening thing. The good news about it is it's immediately recognizable. It'll occur typically within 15 minutes of getting a dose. That's why you're asked to wait around for at least 15 minutes after dose, and it is immediately treatable with epinephrine. So you're not going to die from that as a general rule.
And it doesn't look to be that there are any long-term side effects or long-term effects of the vaccine.
Not that we've seen so far, no.
Are you amazed at how quickly it was put together?
Shocked. I don't think you would have found a scientist on the surface of this planet that when we isolated that virus and sequenced that virus in January of 2020, if you said we're going to have in hand two vaccines, two messenger RNA vaccines in the United States that are 95% effective, that have been tested in these huge trials, what do you think the odds are of that? I don't think anybody would have thought it was possible. So yes, I'm shocked.
And of course, there are additional vaccines down the pike.
Right. I think Johnson & Johnson for the U.S. will probably be the next vaccine we see, the so-called replication defective human adenovirus vaccine. The U.K. vaccine may be something we'll see soon in this country. And then there are two other vaccines that are made by Novavax and then GSK Sanofi, which are the so-called purified protein vaccines like the hepatitis B vaccine or the human papillomavirus vaccine that I think we could see by April.
All right, very good. Well, Dr. Offit, thank you so much. We appreciate you being here, and thanks for your insight.
My pleasure. Thank you.
And coming up, we'll talk to an infectious disease physician here in the Susquehanna Valley. More about the vaccine and what he experienced when he got it.
This is WGAL 8 in Focus. Coverage you can count on.
3 regional health systems in the Susquehanna Valley recently sent out a joint statement about this critical time in the pandemic. Representatives of WellSpan, Penn State Health, and Penn Medicine said, quote, if current trends continue, hospital leaders are increasingly concerned. Healthcare facilities will be overwhelmed as shortages of healthy caregivers make it difficult to handle a rapidly increasing number of patients. Unfortunately, this is already happening in parts of our country. The next several months will be critical, even though vaccinations have begun. Widespread distribution is months away. Everyone must remain vigilant, take precautions, and follow public health orders. I'm joined now by Dr. Eugene Curley, an infectious disease physician at WellSpan Health. Thanks so much for being here.
No problem. Good to be here.
Are you dealing with this same kind of thing we are seeing across the country?
Yes, we are. Our hospital census at WellSpan Health has been near capacity pretty much since mid to late November. So we're feeling it as everyone is nationwide.
What do you attribute that to?
It's difficult to say. What I can say on that is back in the early spring, a lockdown was instituted, and we clearly saw that the number of cases and hospitalizations trended downward. And since we've opened back up, we've seen these cases rise. I mean, some of that could be that, people are just tired of being stuck in the house. I definitely understand the potential economic and financial ramifications of a lockdown, but we're definitely seeing the worst of this pandemic at this time.
And what's your concern about the months ahead?
Yeah, my hope is that we're going to start to see some improvement now that these vaccines have begun to roll out. I mean, this is our shot of hope. I'm trying to stay positive, but I can tell you as a healthcare worker that has been doing this almost for a year now, we're feeling it. We're stressed, we're frustrated. We'd like to get back to some sense of normalcy. So hopefully this vaccine is the first step to that. It won't be the only step. We'll still have to use our safety protocols, mask up, social distance, and practice hand hygiene. But it is a step in the right direction.
In terms of the vaccine, what is WellSpan's strategy for giving the vaccine at this point?
Yeah, so our vaccination program is informed from guidance from both the CDC and Pennsylvania Department of Health. As you probably heard, they have a phased approach to allocating these vaccines. We have started phase 1 of 3 of the vaccine allocation, and things are going very well so far.
And a lot of people are asking, well, what about me? Where am I going to get the vaccine? When am I going to get it? I'm not a healthcare worker. What do you tell those folks?
Yeah, so stay patient for now. Stay vigilant. Help is on the way. We have to wait to see what the supply is, and we also have to get that approval from Pennsylvania Department of Health to let us know that we can progress on to phase 2 and phase 3 of being able to vaccinate the general population. Phase 1, as of right now, because of the limited doses, we're focusing on healthcare personnel, frontline caregivers, and residents of long-term care facilities.
What would you advise someone who's sitting at home, thinking, I want to get the vaccine? What should I do?
As I said, be patient. Help is on the way. It's hard to give an exact date of when this vaccine will be available to the general population, but experts are estimating sometime around the spring. Keep in contact with your family doctors. If we get lucky, maybe that we'll be able to start vaccinating sooner, but definitely keep in contact with your family doctors, and they will let you know when you're eligible.
Did you get the vaccine, Dr. Curley?
I did. I got my first shot on December 26th.
And how are you feeling? Any side effects?
Feeling great. I only had injection site pain for about 2 to 3 days in my shoulder, but no other side effects.
Let's talk about the coronavirus variant. We have just heard now that it has been identified in Pennsylvania. What's your concern about that?
Yeah, so it's a rapidly emerging topic. We don't have all the answers yet on this topic. All of the experts are really saying about this new variant is it seems to be spread a little bit easier. There's no evidence right now that it causes more severe disease. Experts are also suggesting that the vaccines will work against these new variants, but this is to be expected with viruses. All viruses mutate naturally, from flu to HIV, and definitely the coronavirus that causes COVID-19.
This virus has certainly been unpredictable in a lot of ways, and we've certainly learned a lot in this past year.
Definitely, definitely.
Well, Dr. Curley, thank you so much for joining us, and we wish you the best.
Likewise.
Thank you for joining us for WGAL 8 in Focus. For all of us here at WGAL, I'm Susan Shapiro. And join us again next Saturday night at 7 o'clock for WGAL 8 in Focus after NBC Nightly News.